Namaskar. Greetings from Apollo Hospital, Noida. I'm Dr. Tapaswini Pradhan, and I work as a senior consultant in head and neck oncosurgery. The topic of our today's discussion is changing landscape of head and neck cancers. So friends, head and neck cancers is a major public health issue in our country and is the most common cancer among the males. It ranks fourth among the females. According to the International Agency of Research on Cancer, it is stated that by 2040, we would have a 50 to 60% rise in these cancers. Major age group afflicted is 60 to 70 years, but unfortunately, we have now started seeing 20 to 50 years as the age group in 35% of the cases. 70% of these patients present in an advanced stage, in spite of the fact head and neck site is a very visually amenable area. As a result, in spite of the advancements and radicality in our treatment, the survival continues to remain at 60%. It is said that 60% of the patients will have failure at the local site, 30% will have spread to the distant organs, and 12% of the patients may have cancers again at a different site in the head and neck region. Major cause behind head and neck cancer is tobacco consumption, 80% to 90%. Whether it is smoked or the chewable form, heavy smokers and heavy consumers, the incidence is 5 to 25-fold higher. The other factors are alcohol, which contributes to 70% of the causes. The other factors are areca nut, pan masala. There are viruses implicated, human papillomavirus, Epstein-Barr virus, HIV, herpes simplex. Diet also has a good amount of contribution. Diet deficient in vitamin A, C, iron, zinc, selenium, etc. Occupation hazards. People engage in certain occupations like wood industry, paint industry, tanning industry, leather industry, smelting industry. The fumes produced from this industrial area has been known to cause silonasal cancers. Excessive exposure to ultraviolet rays are cause of skin cancers. Often people ask how genetic factors are related with head and neck. Yes, it has been seen that if there is an index case in the family and also the habits of tobacco or alcohol is prevalent, if the siblings or if the child of that particular family also has similar habits, would be predisposed to developing these cancers by 3 to 4-fold times. Since most of the head and neck cancer patients present in an advanced stage, the treatment remains as a multimodal treatment therapy. Surgery plus radiation remains as the standard of care, that we have understood the biology of these cancers much better. There has been so much of research because of which we have gone into the depth of genetics and also the molecular basis. And that has made us change our treatment modalities to a great extent. If we look at surgery, a lot of things in the technology have added to our armamentarium, like the lasers and the robo, which have made these processes minimally invasive. As a result, patients recover faster, they have quicker recovery, they have shorter hospital stay, lesser surgical morbidity, and a quicker return back to work and to the society. Microvascular surgery in the field of onco-reconstruction has eased a lot of our results because patients with head and neck cancer are always fearful of two things. One is the disfigurement and the restoration of functionality. But with microvascular surgeries, the two aspects which patients really dread and fear have been taken care of. If we look at radiation, which is primarily a technological driven specialty, has had so many development in their instrumentation that the delivery of radiation has been with fewer side effects, lesser toxicity, and has given patients better quality of life. Medical oncology also has paced in a long way. Lot of newer therapeutic drugs, chemotherapeutic drugs, immunotherapy, and targeted drugs have come in, which have made things which were considered impossible as possible. Patients with distant metastasis with extensive disease are being treated with these therapies, and we are able to give them a fair amount of survival. But friends, what's important in the entire thing is prevention. And as we have realized, 80 to 90% of these cancers are tobacco driven. So prevention is and awareness is something which is the key thing. As it is said, 1 ounce of prevention is worth a pound of cure. So the inexpensive method of cancer control is prevention. Change your habits, change your lifestyle, indulge in a lot of physical activity, avoid being overweight, so take into healthy dietary practices, follow the immunization protocol, and live a healthy lifestyle, be positive. And that's what I would love to share with all of you. Thank you so much.